everybody. My name is Robert Hall with Project Elect, Enthusiastic Leaders Engaging in Changing Times. Happy New Year to you all. It's been a while since we've talked and since we've been on stage, but we're glad to be back in the community with some very important information that we're about to bring and new information. And so we're Project Elect, trying to put information out through the community, things that we can use, things that's spiritually, things that's economically, things that's educational, things that's going to help us in our health-wise. And so over the last few series, we've talked about a lot of things dealing with COVID. We had a lot of different medical professions to talk to us since this thing has started. Tonight, we feel that it's important to be back with our very own Dr. Vernon Rayford, our community doctor. So we know that Dr. Rayford now is no stranger, certainly to Tupelo community, and now even nationally. It's been a while, but some things have taken place with COVID, and we know that we went through Delta, which may be still here, I don't know. Now we got Omicron, and there's a lot of new things that's come up. And Dr. Rayford, welcome.
Thank you.
Welcome back. And there's been a few things that have taken place. You've received some awards.
Yes.
I'm throwing this on you. It's a surprise.
Yep.
I know you received an NAACP award.
I did.
You received the Project Elect award for Member of the Year. You actually gave the city address for the Thanksgiving. so you have been very, very busy. So there's a lot of transpired. There are people getting sick, the new Omicron virus, and there's a lot of unanswered questions.
Yeah.
I don't know the numbers, but I hit you right off with what's changed in the numbers since we discovered Omicron.
Yeah, my goodness, Omicron has hit us like no other COVID wave. Omicron, in terms of the sheer magnitude of the number of infections and the disruptions, is worse than anything. If you want to compare times during the pandemic, the early times the disruptions were due to the unknown, and so even to the point of places shut down, Omicron's disruptions are as the same, if not more, than the initial kind of shock of this unknown pandemic. In terms of sheer numbers. Over the last week, the state reported 50,000 infections. And I want you to hear me say 50,000.
Just the state of Mississippi.
State of Mississippi reported 50,000 infections. We're approaching the hospitalization record again. We fortunately haven't seen the uptick in deaths as significant as we saw in Delta variant. In Delta variant, that the uptick in deaths followed the cases really, really closer. There's some evidence from other places that Omicron on an individual level is milder, but I really want to caution people to not miss all of the disruption that 50,000 known cases of Omicron. Many people are diagnosed with Omicron through home testing, so those aren't accounted for in that 50,000. Many families, if one member has a documented infection and they get sick, some of those families don't go on and get tested because they're not doing anything different. And so for every one of those positive tests, there could be one or two other family members who have COVID. And so if you see the math, we're talking, easily if one or two other people have infection for everyone we know, you're seeing 150,000 potential infections in the state of Mississippi. And in terms of the mildness, Omicron still leads people to be in the hospital. If that percentage is lower than Delta, if you are causing 4 or 5 times more cases, you're going to break the record for hospitalizations because of a sheer numbers kind of thing. So I want people to know that we are in a bad stage of the COVID pandemic. There's so many cases of Omicron, there's so many disruptions. You can't imagine one aspect of life that has not been disrupted by Omicron. Schools have had to suddenly change plans, extend breaks. Hospitals are on skeleton staffs because of the number of people out with infections. Pharmacies have run out of many common cough and cold medications. Vitamins aren't on the shelf anymore. The prescription drugs that we've used for COVID infections, the monoclonal antibodies, are extremely in short supply. And so now there is more restrictions on monoclonal antibodies. The new COVID antiviral pills are restricted because there's just not enough. And another big challenge is that the whole country is experiencing the Omicron wave at the same time.
Now, I'm going to ask the people to please share this because we're about to get off into the meat of things here. And I know one of the words you use, and I'm going to keep it simple, Syndrome. You use bad, but in the same sentence, you almost said that most people are not we won't have much death as we had with Delta. And so that's confusing. I guess to my mind, I don't know about our audience. But
Yeah.
Can you break that down some?
I think so, and I think that's part of the confusion, that people are rightfully confused. That if we look back over the last 6 to 8 weeks, as we were talking about the scariness of Omicron, in the same lines in many news reports, we were hearing Omicron is mild. Omicron is mild.
Right.
And so you can, at the same time, be mild, disruptive, and deadly. And so if you just take COVID infection by itself, whether that infection will land you in the hospital or whether that infection will land you in the morgue, Omicron is milder than some of the previous variants. But we don't exist in a vacuum. The problem is, Omicron is so contagious. I don't know if anyone has needed to go to the emergency room or go to an urgent care or even to get the phone answered at their doctor's office. The problem is the sheer magnitude of all of the people trying to access care means that if Omicron doesn't kill you, something unaddressed, something that's been delayed in terms of the treatment, something that hadn't been recognized, those are the things that's really death. So the true cost of Omicron may not be measured in direct Omicron-related deaths. It may be disruption-related deaths. If you were in the hospitals that have had to declare mass casualty kind of statuses because there were more people than people to see them, that care was different. That care was mass casualty care. Those who understand mass casualty care recognize that you don't get what you think you're expecting to get. Decisions are made based on limited resources. And those limited resources are deployed in the most way that they believe is going to be the most helpful. It may be hard to have someone that you know you can't take care of being told you got to go back home because there's just nothing here for you. And so the disruptions, and I go back, it is both possible, and that's what we're seeing with Omicron. It is both individually as a COVID variant, mild, and less likely to cause you to be in a hospital, and less likely to cause you to die. But we're going to break records in terms of hospitalizations with Omicron because of its contagiousness. You know, one number I hadn't said, Robert, one day, and I don't remember what it wasn't even news. One day, there were 1.5 million cases of COVID reported in one day in the United States. 1.5 million cases. At the height of Delta, we were getting up in arms about 300,000, 400,000. In one day, we tripled or quadrupled the number of cases. Our population is tired of Delta. It's not even, our population is tired of COVID. It's probably not even the biggest news story out there, but 1.5 million new diagnoses of COVID. Those are the people who were able to find care. Those are the people who were able to access testing. Don't forget all of those people who tested at home. And so the magnitude of it makes Omicron it may still potentially be the deadliest variant, but the deaths may come from the disruptions. Hospitals can't take care of people because we're out sick. The pharmacies can't get the needed medicines because there's such supply disruptions. The trucker can't bring the medicines to restock the pharmacy. The manufacturing place can't get the medicines too. And so if you're not noticing these significant disruptions, you're very, very well off and don't need a lot of these different things. But, you know, if you've been paying attention for the last 3 to 4 weeks, it's just been so much harder and so much longer to do the regular stuff.
Let me ask you this, Doc. Okay, a few months ago,
Uh-huh.
we were sitting right here and you were saying, you know, gotta get your shot, gotta get your shot. Okay, so we were saying, hey, people, go get the Pfizer, go get Moderna, go get Johnson & Johnson. This is gonna prevent death. This is gonna prevent, you know, whatever. Now, months later, you guys tell us we got a new virus and we gotta go get boosted.
Yep.
And so I'm hearing people say, well, I done took 2 shots, now I gotta go take another one. And then you say, well, I know somebody that's been boosted and they're still sick.
Yeah.
And so people are saying that the medical organization, you guys are so misleading. I'm just being direct. So I'm just trying to understand this.
Yeah. So put in a plug. Everybody needs to have a healthcare professional that they trust. Healthcare professional that you trust has been trained to make sense of the different processes. Everybody needs that. I caution people from getting these I caution people to not have this false sense of expertise when they don't. And I'll put it simply. I can read every book about flying a plane. Under no circumstances will I even enter the cockpit. As a physician, we train years and years and years for this. You can't read up on COVID sitting on the toilet. You can't read up on COVID in your conspiracy group. You know, your news outlet, is not going to give you COVID in 15 seconds. And so a real plug for healthcare providers, clinicians that you have a relationship with and can bring up these, challenges. Hey doc, it doesn't make sense. Well, let me tell you that one thing about this pandemic is we're learning in real time. And the pace that we're having to deploy our decisions is so much faster than we've had to do it before. Because we also understand that if you arbitrarily delay effective things, those people who are harmed or die don't have to be harmed or die. And so we're deploying our interventions in real time. If anybody has had a child and has gone to a pediatrician, you know that there's a series of shots that you receive. 2 months, 4 months, 6 months, 12 months, 18 months, 2 years, 3 years, 4 years, 5 years, 12 years, college. At one time, each one of those vaccines started out as a single shot. And over time, we learned that you needed a series of shots to get the best protection. Step on the nail, it's been 5 years since you had your tetanus, you get a shot. Been 10 years since you had a tetanus, you get a shot. At some point, one tetanus shot came out. And we in the medical community realized that, oh boy, these people are getting tetanus even though they had their shot 10 years ago. I think we need to give a booster. And so don't allow our circumstances of learning in real time have you take unnecessary risk. So for those people who were confident in the vaccine for 2 shots, don't let the knowledge that you need 3 shots for a better effect dissuade you from, and the testament of knowledge, is biblical. When you don't know better, when you learn better, you do better. That is not flip-flopping, that's not confusion. That's using what you know. And so you really need somebody who's going to help break this down and just let you know and give you a context that at one time or another, the things that we commonly do was a new idea or a new drug or a new vaccine. And over time, we refined that and we've gotten so good that people don't know just how bad. If you ask someone who remember getting polio, or remember being afraid of polio. You know, some of the older folks who remember the government came to the schools, folks lined up, they got the polio, they got the polio vaccine, and that was it. And so, but the fear that they had about polio, measles, and things like that. And so, what I would tell them is that we are acting on the research and data as they are right now. We've learned, it's been 2 years. There's a lot that we know. Right now, there's too many people, because they're frustrated with the pandemic, not utilizing what we all know works. And the last thing I'll say, Robert, and I'll throw it back to you, is that we also, in healthcare, and it's worth people realizing, and I've said this before, and I want to go real slow. When vaccines are out, there's 3 big things we want a vaccine to do. And I normally tell people the order at which, if it happens, we are satisfied. We want the vaccines to keep people alive. So vaccines to be the difference between people who've been vaccinated, when they get this disease, they have a lower risk of dying. COVID shots do that, and they consistently do that. So if you look at, and we keep track of that, those people who died have predominantly been unvaccinated. There are some people who've been vaccinated that still die. But you have to understand that the risk of reduction is so low that the big group that you don't see, all those folks who've been vaccinated and protected, are living through their infections. We want vaccines to keep people from having severe disease. If you catch COVID, the vaccine helps you not need to be in the hospital, not need to be in ICU, not need to be accessing the emergency room at a time where they're really full. The vaccines continue to do this. And then the third thing, we want vaccines to reduce your risk of getting an infection. And I think some people have conflated a reduction in risk with an elimination in risk. Nothing that we have, there's been no vaccine that has 100% eliminated a risk of infection. And in fact, understand, and so when I'm promoting the flu shot, I'm promoting 1 and 2. We confidently know that the benefit of the flu shot, the pneumonia shot, is to reduce the complications and reduce the risk of dying from flu. COVID, I think at a point we were hoping that we could just stop people from catching COVID, and we really didn't communicate clearly early enough what good enough looks like, and what good enough looks like for all the other vaccines that we've used. And so we missed an opportunity to tell people that if we are putting our thumbs on the scale and we're increasing your chance of living, increasing your chance of not having a severe disease, we are succeeding. And vaccines are succeeding. Those who want to potentially mislead and simplify will say, hey, if the vaccinated can catch COVID and the unvaccinated can catch COVID, vaccines don't work.
Right.
I saw a meme on social media, it's like saying Serena Williams can play tennis and I can play tennis. Right? So, so it's one of those things that really important. Keep people alive, keep people from having severe disease, and reduce the risk of infections. What we're learning is 1 and 2. The vaccines do a great job of it. We are, as a scientific community, determining what are the goals, because there's still a significant need for many parts of the world for dose 1 and dose 2. At what point do we, as a global society, say, I'm sorry, United States, you've had 2 years. Why don't we just make sure the rest of the world can get 1 and 2, and quit trying to give you 1, 2, 3? maybe more. And so I think that's a case that can be made that, 2 years in, those people that, really want to make sure folks have access to information, access to the vaccines, but also want people to understand the risk. And so a lot of people, have, a lot of people are, owning their risk.
So,
Got some questions.
I'm gonna get with you, and this is getting good. So Kenneth got one, I got one right before we go to Mr. Wheeler, and I'm gonna ask the people to continue to please share this information, Project Elect, because it's really important. This just came down, it's been coming down for a few weeks, but I heard it like at home this week. Usually it was 10 days when someone's diagnosed with COVID symptoms. Now it's back to 5, and there's a lot of things that go in there.
Yeah.
But then you're having employers to tell their people, because it's so hard to find work these days, that hey, it's 5 days, you just get back in here to work, and let's move on. So people are manipulating this, especially, and I'll just go and say it, some employees, restaurants, whatever, your gas stations are saying, hey, you're okay now. So they're being the doctor.
Yeah.
What do you say to these employers that's rushing their people back to work that's been diagnosed with COVID?
Hey, that is another source of confusion. And again, you need a healthcare provider, clinician, that understands the kind of weight of, where recommendations come from and what kind of scale they're using, what their counterbalance. I'll tell you that, I'll just say that I can both be, so I look to the CDC, I look to the state health officer, I look to the NIH. Those are places that provide me information that I use to make the best decisions for the people in the community, or decisions for the patients. I can both lean on them for information and also think that some of the information doesn't make a lot of sense on the individual. And so from a public health standpoint, what you're doing is you're thinking about populations. You're thinking about populations. You're talking about the city, the entire workforce, the entire state, the entire country. Some of those decisions come with, well, what if we tell them something really restrictive and there's no chance that people will do it? And so one case that, and I'm thankful that's not my job to say, hey, what do I think most Americans will do? But I will say that some of those factors that go into those recommendations kind of have, this isn't ideal, but this is what we think most people will do. And so it's better to tell people 5 and get 60% to do it than tell people 10 and get 10% of folks to do it. And so that's a case in point. I'll tell everybody that, look, when it comes down to making individual decisions, then you need to understand where your risk lies. If you live or are a vulnerable person, then your decisions, if you want to protect your health the most or protect those vulnerable folks, you're going to be more conservative. 5 days is not enough. And I'll just simply put it out there. I've had COVID, and we can talk about that before. If I didn't have COVID, I wouldn't want to be seen by somebody on day 6 after they've been. I wouldn't want them preparing my food. I wouldn't want them in my house. I wouldn't want them, because I know that there's a spectrum of contagiousness.
That's deep.
And that there are some modeling studies that show that maybe 1/3 of people are still contagious at day 5. At day 7, it goes down to maybe 16%. At day 10, it's about 5% of contagiousness. And so a longer period of isolation makes sense if, you're taking care of your elderly family member and you've been able to really restrict your access. Go a few more days. And so, right now, I tell people the CDC guidelines are the bare minimum. But, me being sick with COVID, I wasn't ready to come back and optimally take care of my patients at day 6.
And I want to get deep into that, and I know Ken's itching down there. You got a couple of things.
Yeah.
But I want to get deep into your experience right after we take
I've got a few questions, and basically, there's some questions I think you've already answered. How many deaths from Omicron, and were the people that died vaccinated? But then he got an interesting one here, Dr. Rayford, and that is my brother had the booster, Moderna, and he now has extreme muscle aches. What happened to him?
That's a good question. I'll answer the second one first. I don't know. I don't know. And, you know, when it comes to the vaccines, we do know that there are side effects from the vaccine. Some people feel them more than others. Most people don't. You know, in terms of like severe, debilitating side effects, that those things are really rare. But we also have to understand that there's causality and then there's association stuff. And so causality would be, I put these shoes on and it rained. Putting these shoes on didn't cause it to rain. You know, versus I flipped that bottle over and the floor got wet. I caused the floor to get wet. I didn't cause it to rain. And so sometimes when it comes to vaccine, we're getting, you know, being out in the community with the Northeast Mississippi Coalition Against COVID-19, we've given out 2,000 vaccines. We've given out probably much more advice. I had my vaccine and then this happened. No, it's not something that's been associated with the vaccines. And so, you know, there are vaccine side effects. Muscle aches can be a part of it. Can be some part of, you know, a side effect from the vaccine. When it comes to vaccine side effects, they are usually short-lived. You know, a person who they get in their muscles, even if it lasts 12 hours, they may be the most miserable 12 hours they've had, but it tends to be short-lived. And then the first question was, how many have died from Omicron? That tally is still ticking up. And we also have to be careful to, you know, at some point, we'll be able to, because deaths are recorded, we'll be able to calculate something called excess deaths. And so usually in populations, the death rate tends to be pretty stable over time. And so they compare it to 3, 4, 5, 7 year time periods. We knew that with COVID, there were a lot of excess deaths. And so some of that could be from undiagnosed COVID or all of the disruptions. And so, you know, months down the road, there'll be a look back to say, hey, during Omicron, the number of people coded for COVID might be lower, but these excess deaths may be higher. Have they been vaccinated or not? The predominant number of people who are dying are unvaccinated. So 3 for every 4, easy. 3 for every 4 have had 0 vaccinations. And if that number doesn't make people, if somebody tells you 75% of something happens, but then, and you're in that 75%, and they're saying, well, what about the other 25%? You may have to try another approach with that person because numbers don't work for them. And the other reality is we do know that there's some vulnerable people who continue to be vulnerable. And so that's another thing for us to say, even vaccinated, a lot of older folks are still vulnerable. So the young people, if they really wanted to protect those older folks, if they thought that protecting the older folks was a little bit more important than exerting some control, then they may make the decisions to get vaccinated or make these changes. And so now there's kind of 3 different statuses. There's completely unvaccinated. Then there are you got the primary series, the 2 shots of Pfizer, Moderna, and the 2 shots of, or the 1 shot of Johnson & Johnson, but you hadn't gotten a booster. So maybe we call them the unboosted. That's the next big group in terms of people who die. Most of those are high-risk people anyway. But that make up the big group. And then I think the last number I heard was in the state of Mississippi, there were 0 deaths of folks less than 49 who were vaccinated and boosted.
One quick other question that came through was kind of correlated to what you're talking about. It said, I had COVID. Is it possible that I can carry and infect others? That
Yes.
I can still carry the virus and infect others?
Yes, it depends on timing and it depends on the severity of the COVID, which goes back to 5 days CDC, is it enough?
Right.
So another consideration is, if you were really sick, like it needed to be in the hospital sick, it's thought that you're contagious for maybe 3 weeks, 4 weeks. And so we've always had caveats that if you had moderate to severe COVID, you needed a longer period of isolation. And so, yes, you can still, and remember when I said that, at least based on some modeling studies, that a third of folks are still contagious at day 5, 16%, what's that, 1 in 7, 1 in 6, 1 in 7 folks are still contagious at day 7, and then at 10, 1 in 20. That number gets to 0. And so over time, so even some people at day 14 are still able to spread COVID. And so it goes back to, that individual risk assessment of, do I want to be responsible for causing somebody COVID that could change their life and change their family's life? And so for me, I've had COVID, presumably the Omicron variant. Why do you still wear a mask? On the odd chance that even 1% risk of passing the infection on, I don't want to take that. And that's because as I'm weighing things, that's just not something that's compatible with kind of how much I care for folks. And I'm willing to be uncomfortable to not, and I think other people, maybe want to put it out there, are you willing to jeopardize other folks? And if it is, we just call it like we see it.
So Doc, we've talked about this.
Yeah.
You know the pharmaceutical side, you know why we needed to take the shots. You guys say, hey, wash your hands, you stay 6 feet apart, you wear your mask, you want to keep your rooms ventilated. Who more probably has done that besides you? You've lived it. We watch you. You preached it over and over again. And Dr. Rayford comes down infected with COVID. If Dr. Rayford came down with COVID, I'm doomed.
Yeah, so, I want to go back, because Dr. Rayford's a human. So Dr. Rayford's a human, and fitting in is something that humans want to do. And Dr. Rayford, I wasn't 100% mask wearer. There were time periods where I felt that I was in a bubble of protection. And there were certain circumstances where I felt that I was in a bubble of protection. And one thing that COVID has been consistent with, and in fact, has only gotten better at it. Over this whole pandemic, COVID has said, when you give me a chance, I'm going to take it. And in Omicron, that's the best COVID variety that will take you up on that offer. When you give me a chance, I'm going to take it. And so, I kind of wrote down some stuff that, we have still, too many unvaccinated folks. So almost 50% of folks in Mississippi. That's just too many. We have too many unmasked people. We have too many people who are living life as if COVID is not going on. People that looks like they're intentionally living as unfazed by COVID as possible, including going around folks when they're sick. Folks that can't imagine they have COVID, so that fever that they had before Christmas dinner, it broke, so I went to Christmas dinner with grandma. 2 days later, it's COVID. And so we have all of that, and I think, I want the audience to know, when we look back at it, we're going to look back and say, only in America, only in Mississippi, did we show the world everything to do to make the pandemic kill as many folks as possible, maim as many people as possible, disrupt as much business as possible, kill our economy. We figured out the way to make COVID's life easier. In every surge, we've actually gotten worse. We've gotten worse. There was a point when we were afraid of COVID. You remember a year ago, how we were doing. We didn't have the therapies. Guess what? We don't really have the therapies now, in terms of what really works and what's on hand. And so we have really, it feels like
I guess we've just decided that we're gonna prove the worst way to do the pandemic, and we've taken pride in our actions, that we are intentionally trying to show the world the counterpoint to places like South Korea and Taiwan. We're trying to show them the counterpoint so history can just see how many, just see what a divided population can do in the face of a pandemic, and how other places that have kind of just gave the healthcare the benefit of the doubt to say, I might be uncomfortable short term, but you might be right because you're trained and you've dealt with this before. But it just looks like we're trying hard to do everything to help COVID.
Well, speaking of that, I guess just getting into reality, and I guess I'm probably asking where a lot of people think, and some probably have experienced it. I found out that some people that have maybe disappeared for a few days that you would frequently be around, and they keep COVID a secret. Even say I have some other type something, whether it's the flu or pneumonia, but they won't admit to that it was COVID. But when I call you, a public figure, a doctor, medical doctor, and I can't remember, we hadn't talked in several days, and probably the third sentence you said is, Robert, I have COVID. And that told me a lot, in that you wanted to be open with it, but most people are secretive with it. Is that a danger?
I think it's, so I do think that, so I'll say that being sick probably weren't, I wasn't posting on Facebook, hey, I got COVID. And so some part about being sick, you just might not feel like being that kind of in your face and open. But there's also a component of this is a shared experience in the community, and in terms of infectious diseases, I think at some point, it's important to know that, and I won't say if it could happen to me. No. I'll just say there's so much COVID in the community that, that I gave COVID the chance to infect me, not intentionally, but I got COVID. And that experience, and telling people, the experience with it, I think it's a rich experience. And I can tell you that, many people ask me, what's it like? You didn't ask me. But, I've taken a trip. I went out of town. I went in a place where there was a lot of unmasked folks. There was a false sense of security because this place required proof of vaccination or proof of a negative test. And so there was this false sense of protection. And so we were, doing things that, we wouldn't have done comfortably, a year ago, eating in restaurants that, were full capacity. And so that false sense, this place, maybe 15, 20% of folks were masked, other people, but in a restaurant, 100% of the folks are unmasked when they're eating. And so just, telling folks that it's still possible to postpone getting infection with COVID and prevent getting infection with COVID, but you're gonna have to scale up and scale down those interventions that you do. Robert, remind me to talk about masks when we get past this, but yeah.
I got a question and just so happens to be about masks. Dr. Rayford, it says, how long or often can I use my K95 mask?
Yeah, that's good. So let me tell you, in ideal circumstances, many of these masks are single-use masks, and in ideal circumstances, pre-COVID, when there's an adequate supply. But we know extreme limitations, and we've actually learned that we stretch out different things. And I might just go on and talk about masks here. If the mask is soiled, so you can see that it's dirty, in a mask like mine, if you can see that the creases are kind of worn out and kind of frayed, then it's time to get a new mask. What's really important now is in 2022, we've also learned that the type of mask makes a difference. And so at a point, we say cover your face. And there's actually been data from different places. And so data from different places to show that different type of mask can yield different benefits. So the mask that's kind of like a piece of cloth that kind of wraps around the neck is called a gaiter. Bandanas, worthless. So gaiters,
Well, thank you, I have one of those.
gaiters and bandanas
Don't
are, those are fashion accessories. So gaiters and bandanas, and so I got some mask here, and so previously, the thought was in a time of scarcity that a 2 to 3 layer cloth mask was something that was going to give you a protection. This is not enough. And so, particularly with Omicron, cloth mask, unless they are, can you come up and show your mask, Mr. Wheeler? Unless the cloth mask has, you can show them right there. Unless the cloth mask, and you can't tell, but that mask actually has like zinc and maybe copper impregnated in it. And so that mask has some antiviral properties inherent to it. You wouldn't know it, but that's a special kind of mask that, it looks just like a cloth mask. But so there are some cloth masks that may have some special treatment to it that has that just kind of has some antiviral properties that may be equivalent, particularly if you're kind of peripheral to direct patient care. Mr. Wheeler works in the hospital, but he's not in the patient's rooms kind of as a regular part of his job. And so the cloth masks are, I would say they're better than nothing. If that's all you have, then things to consider is doubling up, putting 2 on, and also making sure that you have a good fit around the chin, around the chin and the sides of the face, and then on the nose too. And if you can see your nose, then you're not getting full protection unless you are 100% mouth breather. But if you're going to wear the mask, be honest with yourself. Just wearing it doesn't get you the benefit. Wearing it appropriately. So the cloth masks are better than nothing. But I encourage people now that masks like these, procedural masks, you may find these in blue, black, but more procedural masks. These are better. They have some properties that are antiviral. These are a lot better. Ideal circumstances, these are single use. And I don't think we'll have a mask shortage because we still have a large portion of the population that are anti-mask. And so that means they're available. And there's actually been reports that the federal government is going to make some masks available to the general public. What I saw in the report is that the masks are going to be the special type of mask. So this mask is an N95 mask.
Okay.
And so N95 masks are designed to reduce the penetration of 95% of the particulates. And so there's some industrial N95, so folks who kind of work in construction. And then there's the medical grade N95s. And these N95s, this is the standard we use in the United States. There's something called a KN95. That standard is more of a Chinese standard, but there are some K95s that are acceptable. And again, the presumption is that they filter out 95% of the particulates. And what's really important about these is the fit. So if this is hanging off under my chin, this mask is too big, and I'm not getting that 95% kind of the filtration type thing. And so, but if you're in a high risk circumstance, say somebody got COVID, the N95s or the KN95s are the best. And then some advice about making the mask last long. Ideal circumstances, these are single use, but not ideal circumstances. So what you can do is you can actually keep the outside of the mask clean. We know that if you keep the outside of the mask clean, you handle it delicately. What you can do is you can wear a procedural mask over the N95 to stretch it out. But it's really important that January 19th, 2022, it does matter what mask you wear. It really does matter that that you want to reduce your risk of getting COVID or transmitting it. It does matter what mask you wear. And you can reuse them, but when they're falling apart, you know, I've seen many masks.
That's a sign.
I've seen many masks. They're falling apart. If you can see some discolorations and not part, I know a lot of folks, women, wear masks on a full face of makeup. The mask doesn't last that long when it's full of rouge and lipstick and all that. And so those are things that can kind of diminish the protection, you know, from the mask. But the mask that we wear is important. How we wear it is important. And then the last thing I'll say is, you know, you might ask or you might not ask, Doc, you had COVID. Why do you still wear a mask?
Mm-hmm.
And one thing is I still wear a mask because I want to make sure that I want to reduce the chance of giving anybody else COVID, but I also want to make sure that I'm modeling the safest possible behavior. And wearing a mask is the safest possible behavior. That is this uncomfortable? Yeah, I don't love wearing a mask, but I'm willing to risk being uncomfortable to make sure that I'm setting the right example. And so we physicians, clinicians, and everybody else have an opportunity to set a good example. And I'll continue to wear my mask. And another important reason, COVID isn't the only thing going around. And so since I've been wearing a mask, the number of colds that I've caught during the year has gone down so much. And so I don't want to catch a cold. And I don't want to catch the flu because it is going around. And so, you know, I'm wearing a mask for reasons beyond COVID. And so I know you're tired, but I don't want people to let tiredness make them inherently put themselves at a higher risk.
Two more things, and I know we're winding down here, and I will ask you to please continue to share this because this is great information. One thing that I've noticed, like when some people in the car, you have the windows all the way up, there's one person in the car, they're masked up really well, they have on gloves.
Uh-huh.
Is that protecting anything, being alone?
You know it's funny. Sometimes I just stay ready. So, you know, in terms of protection, no, it's not protecting them. But, you know, I also don't know that person's story. So that person might be somebody that need to get out quick, do what they need to get, and kind of get back in.
Mm-hmm.
Or that might be a person who just dropped somebody off who was hacking and coughing. And so, you know, I think just as, you know, automatically seeing somebody without a mask, you know, doesn't mean that they're bad and unthoughtful and things like that. I think the same thing to do with those folks, because sometimes I've been like, I just don't feel like putting the mask back on. I'm only coming from my office to the hospital cafeteria. And so I'm gonna keep my mask on in the car ride because I just don't feel like pulling it off. Or I don't already brushed my hair, I don't want to have to brush it again. So some of those things, I will say that in terms of the transmission for COVID, we understand that the biggest transmission comes from respiratory droplets or, you know, maybe even smaller particles. And so kind of wearing gloves is not as mandatory. And it's always a good idea to frequently wash your hands. Like, you know, it's something to tell people to wash their hands, but it's always a good idea to wash your hands. But from a COVID transmission, biggest opportunities happen, you know, through the respiratory droplets and things like that. So, you know, that person who's full up and get out, they might be might be somebody laying down in the back seat.
Oh, okay. All right. So my last thing, and before we carry this thing out, is our kids, pediatrics.
Yeah.
We know that a lot of daycares are shutting down.
Yep.
The cases are becoming really high. Some kids are too young for the shot. What do you advise now on people that may have kids and keeping them more safe in this new Omicron?
Yeah, so, you know, for confusion, you know, it's been a really confusing pandemic when it came to kids. Early on, we saw that COVID, the early version, you know, maybe the original strain, affected adults way more. And so it began this discussion of kids don't have as bad of a time with COVID. And there's still people who are kind of hearkening back to that discussion and has missed the point that with every wave of COVID, kids have made up a higher and higher and higher share. And so what originally looked like something that kids didn't really, get and spread. Every wave we've had, and so for the first time in the pandemic, there's been over 1 million cases of infections in kids reported in the last week, and that was a percentage. So every wave has been a higher percent and a higher percent. And what we see is with that, all of that COVID, you're seeing more kids ending up in the hospital. Fortunately, we're not seeing the death rate of kids shoot up, but I have to remind people that kids don't live in a vacuum. And so kids, if they make up a small percentage of the 800,000 plus Americans who died, they're related to them. And so how mild is losing both your parents and grandparents to COVID? That's not mild. And so those who are continuing that argument about the mildness of the infection have missed the point that kids don't live in vacuums. Kids live best in a family unit, a healthy, whole, well-supported family unit. And when that family unit is threatened, that kid's entire future is threatened. And if you can't see that COVID is a threat to that kid's entire future, school disruptions. Mr. Wheeler, I've heard some people talk about the educational toll that the disruptions related to COVID have made in terms of learning loss. So kids who already were at risk are further behind academically. That doesn't mean keep schools open in ignorance of how COVID is spread, because you may get what we're seeing. There's just not enough teachers to keep the doors open. That kids can't 300 kids can't sit in an auditorium for one person because they're the only one who didn't get the infection. And so COVID is a real pandemic and it's a real harm to kids. How we talk about that harm is a little different. And we also have to realize that we're not in a vacuum. And so if you protect the grown people, what is COVID gonna do? COVID is gonna take the opportunity that is given. I got a huge bunch of kids that just waiting on me. And with other infections, particularly the flu, kids figure prominently in the spread of flu. And so it's getting that way with COVID, that kids are making up a bigger and bigger share. And now when you're gonna look at how kids transmit COVID, it's gonna look different than it did a year ago or 2 years ago, because we have a different variant, we have a different level of community infections. And so for those parents who are on the sidelines, who are saying, well, I'm just gonna wait, I'll tell them that wait is not without risk. That's a risky wait. And, we can't get COVID behind us unless there's a lot of immunity in each community. And so you can't keep large populations of kids unvaccinated. And you can't keep them unvaccinated. You're gonna see kids make up, and it's hard to see a kid who's sick. And there's not much you can do but wait it out, support them, wait it out. It's really hard. My heart goes out to the educators and administrators, because they're having to, make those tough decisions that we just can't stay open because there's no teachers. We're not out of the woods yet, in terms of just how long Omicron is gonna keep us disrupted. There's a lot of folks that predict it's gonna be short, but one thing I've learned about COVID is don't predict against COVID. We just kind of call it like we see it. And you're out of a wave when you're out of it. And you don't know you're out of it, and you don't know when you're gonna come out until you come out of it. I will caution people to realize that in Mississippi, we have a special set of circumstances. That means no other place in the world is comparable. And so what we see is gonna look a whole lot different. We're probably gonna bury a lot of Mississippians with Omicron because we have a special circumstance, less vaccinations, more people who are living in kind of opposition to masking, people who are kind of proceeding as if COVID's not going around. A lot of people are transmitting COVID when they know they're sick, and they're just not telling people. I think there's maybe an element of shame. Some people feel some shame, and so you may not get the announcement, about COVID, but I do think it's worthwhile, particularly, the toughest phone call I had to make, Robert, was folks that I were around 2 days before I got COVID. Hey guys, I got COVID and I exposed you. For some people that might not be a big deal. They may not care, but that just that's something that really tugs at me to the core, that I, through my actions, put people's, and I know how COVID spreads. And so maybe not their individual health, but I know they have elderly parents who they were coming into contact with to go. And so, that feeling that I have a direct link to a life-changing, illness or event. And so, that really tugs at me. And you don't want to inadvertently, kind of get through the end of this and be like, well, these were all the folks that caught COVID from when you had it and was spreading it. And then these are the folks who lost. I think that I just, that was the hardest part for me.
Well, that's humbling, and I appreciate, and we already have a lot of respect for you, but I think it just went through another level for you to express that in your capacity and your professionalism. Ken, do you have any last?
We had about 5 questions, and I think he's answered them all. The free test, is that legit?
Very good question.
It's actually a great question.
So it'll be worth something.
Yeah, so
That's right.
free test. So if you've been paying attention for the last few months, so the federal government has, through the United States Postal Service, opened up a website whereby every household is allotted 4 rapid home COVID tests. Those tests are good when you use them the correct way. And so a COVID swab is an uncomfortable experience. And so it's not a gentle, outside of the nostril kind of process. And so an individual test has good value if you test and it's positive. If you do it and it tests negative, that might not mean that you're out the window. And so some tests actually recommend you take another test within 24 to 48 hours. So the combination of tests may be better at, but one thing, I appreciate the ability of people to kind of be able to test, but I also worry that, the population really needs to know that a negative test doesn't set you free. And so really have to understand when there are so much Omicron and COVID in the community that if you test negative, and I'll be up front with you, the first test that I took was negative. So I'd gone out of town, came back that Sunday, I felt scratchy throat. That's not my usual. As I normally do, sometimes I have weird little symptoms that don't show up in the morning time. I feel it around bedtime, and I say, if I can go to sleep and wake up, if it's still there in the morning, I'm going to have to do something about it. It's still there the next morning. So cleared my schedule. I got the test, and it was done right, because I know the nurse really took pleasure in swabbing my nose. And after I cried, I sat there and I waited, and it's negative. So I said, I really do feel bad. I really do feel bad. Something's different. Can you do the PCR? And she did it right again. So she swabbed me, and she swabbed me the way she said she was told. And so after I cried again, I waited a while, and then a text from the colleague, you got it. So I was like, I figured. But, just to go back to the testing, that gotta be done right. You may have to do it again, and then a negative test doesn't set you free. Those tests aren't reported. They aren't reported. And another thing you don't need is,
if that test says it's positive and there's all this Omicron in the community, you don't need a PCR. So you don't need that next layer test to tell you that, you know, especially if you
PCR, break that down for me.
Yeah, PCR. So two kind of tests. So the rapid test looks for a little piece, of the virus. It's just
Okay.
kind of sitting there. The PCR, it looks for the virus through its DNA. It looks for its DNA signal. So the PCR is the better of the two, but it's the more restricted of the two. It's the one, because there's so much virus in the community, PCR testing and the supplies you need for the test have been, you know, supply issues. And so in some circumstances, we just don't have the PCRs that we used to have. And so we're relying on rapid antigen, so that's the rapid test. And we're relying on our clinical suspicion. And so there are times like, you know, you need a clinician who's gonna just tell you what's what. If, you know, if your wife has COVID, your kids have COVID in the household, and you coughing and you have muscle aches, you have COVID. When you come and get that negative test, you have COVID. And so, you know, it's really important to know that if you are really exposed in a high risk manner and you have suggestive symptoms, that the negative test doesn't set you free. And so for some people, come back tomorrow, come back in 2 days. And so, you know, I had a guy at work caught COVID. And this was one of the guys that didn't wear a mask. He was one of the proud unmasked folks. And the guy didn't know he had COVID until 2 days after he tested. And so he, you know, exposed, and so he came in feeling bad, and his test was negative. So I said, hey, why don't you come back on Monday, and we'll do this. You come back on Monday, you know, you have all the symptoms for COVID. You know, right now, what we do for it, you know, we don't have monoclonal antibodies available like we used to. The COVID pills aren't readily available, so take it easy. Isolate like you got it. Come back on Monday. If you test negative on Monday and you feel better, you can go to work on Tuesday. Came in on Monday, tested positive. So I said, you know, like I told you. And so, especially when there's so much Omicron in the community, a negative test doesn't set you free.
I'll close out with this. It's something you said at the beginning, and you said it in the middle, that kind of bothered me. We want to be leading in a lot of things. And being a community person, I love my city, my county, my state. We want to be leading in a lot of positive things. You stated twice that we are setting an example for the rest of the nation and leading in a lot of negative things in Mississippi. We're sitting here in Lee County, Tupelo, which kind of worries me. We're leading in negative things that's enhancing the negative things about COVID. Can you, and we're gonna close out on this, can you just expound on that a little bit?
Yeah, I mean, look, it's 2 years into the pandemic. There's stuff we know.
Mhm.
There's stuff we know. And looking at just how things seem like a surprise, you know, there's stuff we know, there's decisions that were made during the Delta pandemic that aren't being made again during Omicron when we have 3, 4, 5 times the number of cases, and you're seeing the consequence of them. And so what I will say is, if you contrast how things are being run, one, I'm from Mississippi, and so, you know, I trained in places that aren't from Mississippi. You know, I trained in Massachusetts, and, you know, just different states have a way about getting their population to do things. In Massachusetts, a little more mandate kind, a little legislate kind type thing. That doesn't work in Mississippi. I get that. But we don't have to legislate kindness. We don't have to legislate hand washing. We don't have to, it's just taken as a pure clinical decision. These are the things that we have shown without any bias to reduce the transmission of COVID. This is a mask. This is not a political statement. This is not an indictment on you. I don't need the governor to make me wear it. Population level, take ownership. Take ownership. Masks make a difference, and we have the additional knowledge of knowing that the type of mask you wear makes an even greater difference. And so what I'm seeing is almost like a sick movie where I'm seeing people make different decisions than they did 4 months ago, but the circumstance is way worse than it was 4 months ago. So I'm seeing places that are not doing some of the things that they were like, we're gonna encourage, require, we're gonna just require. And you're just seeing the natural consequence of it. And so the disruptions are just going to continue. They're going to continue to see folks acting, different than they were 12 months ago, different than they were 24 months ago. And so it's just, sad to see that the same people presented with worse circumstances are not reverting to the things that helped them get out of the next worst thing. So it's almost like as we get to the next crises, we're so angry and mad. Be angry at COVID, but be sensible. Be angry at COVID. It's fine. It separates your anger from taking unnecessary risk. There's a lot of smart people who are angry about a pandemic. People, this is the time we were all born in. God had a purpose for us being born in this time. There are things that we know that make sense. Things that we know that make sense. And, we're not employing them. And it's just the consequence after consequence after consequence. I log into the computer and I see somebody in their 60s who died. Still dying from COVID. ICU still full. Hospital still full. Emergency room still full. People standing in line outside of urgent cares. Walking to Walmart, I might be one of the few people with a mask on. Going to something, we're all sitting right next to each other. And I think there's an opportunity for us to use those tools which worked. I think I would encourage people to look at the bright side that we know a lot of stuff that we can do. Because I got COVID, but I believe it's 100% possible to not get COVID, but you got to do the stuff that work. Those people that are like, you can't come in my house. Those people that are like, I don't go anywhere. Those people that's like, no, doc, probably want to just hang out. I'll call you on the phone. Those folks that are restricted, those folks that are saying, I'm not having Christmas dinner. I done had 65 Christmases. It don't hurt me to miss a 66th Christmas during Omicron. And I want people to not let that desire, that rush to normalize their lives, have them exposing themselves to risk. Guess what you can't get back? You can't get back to that. You can't get back that relative who died of COVID. Can't get it back. All you got is regret. And there's a regret that it's just happening so much, you don't know which one of those family members are saying, was it me? Was it me? Was it me? We've lost so many folks who were careful. So many folks that family protected them from everybody but themselves. And so we also know that the vaccines protect. We do. We know that the vaccines protect. And the sad part is that people are letting frustration with a pandemic that's out of our control make us not do things that are within our control. And that's where my sadness, that's what I grieve for this community. I grieve for everybody we're about to lose. I grieve for those folks, and I'm tired too.
I was just about to ask you that, Doc, and I know it's going long, but this has become personal to you.
Yeah.
And like so many healthcare workers, I know we're losing doctors, nurses, they're leaving. Are you becoming tired?
Becoming tired.
I'm just asking because you're a fighter. I mean, this information, you're out there every day fighting to keep us well, to keep us alive. And I just wanted to ask you as a healthcare professional, are you becoming tired?
I'm tired, and I'm tired, and the fight is a long fight. Someone who does endurance events, I've realized that the fight's a long fight. And I also realize, and I've had a lot of support, a lot of my patients who love me like I'm their own kid or brother or sister. When they tell you, Doc, it looks like you're doing too much. And I say, you know what, I think I am. And so you're right, that as those who are on the front lines, the nurses, the doctors, to kind of check in with themselves and be like, are you tired? Okay. Are you getting to that point where the part of you that you say that's just, that's the good part of me and the clinical part, are you getting emotionally tired and beat down to the point where you're getting angry with folks? You're getting angry with folks for being scared. You get angry with folks for being misled. You get angry with folks for wanting a little bit more time, wanting a little bit more info. And so, you realize that. And I tell folks, I got now the approach that I need to save some of me for the hard work that's ahead. There's a lot of hard work that's ahead. Right now, COVID is on the big marquee blinking neon lights. All the bad problems that we had before have just gotten worse. So the ground that we've lost from all those, and so there's going to need to be a lot of folks to kind of help pick the pieces back up. But it is worth recognizing that we are tired. And so for you in the community, be patient with us. Understand that we've been out of abnormal times for the last 2 years. Clinical stuff is going to take longer. It's just hard. We're trying to do the best we can. We're trying to make sure that we are being in the places where our impact is higher. So, the choice between someone in immediate danger and someone who's just uncomfortable, sometimes we're going to have to make those choices. And so people might not get, get what they've been waiting for, because somebody else who waited shorter is in a much worse place. And so, I encourage folks to be kind, be patient. I encourage folks to, also be cautious with what they're kind of presenting out there. This conspiracy stuff. Think about the family members who are day in and day out, doing everything they can to help, to do what we were trained to do. And, and we're losing folks. Folks are being lost because they just can't take it anymore. And so we encourage y'all to, we need encouraging words. You don't have to do what I say, but just be cautious, guys, and don't take every recommendation as an invitation to debate. Here's the reality. You didn't go to medical school. Simple as that. If I got sick, I'd never call you, for advice. And so simple as that. When things go bump, when mama, grandma, and all that sick, who you come to? Just be cautious of that. I will say that another thing that I've had to do, Robert, is, take control and ownership of my social media is mine. And so I choose not to debate. I choose not to engage in scenarios that are not designed to help people. And so, I tell folks in the community that, be cautious, of all of our stuff. When we're volunteering. I've had somebody on social media say, I got blood of people on my hands. This is somebody, I don't even remember who said it, but, all that I've been doing outside of work in the community, and here you go. And so, some communities are losing the people that are going the extra mile. How much do I get paid for this right now, Muhammad? Nothing. How much do I get paid for all the volunteer work for, the Northeast Mississippi Coalition? Actually, it's a negative number because there's money being pumped into it. And so, to kind of be sensitive to the folks out there that's just trying to get the information out there. And the last thing I'll say, Robert, is all want somebody who's going to tell you what's right. You don't want somebody that's going to tell you what feels good. And in this pandemic, we really need to make sure that we got people that's telling us what's right. You know, and I think sometimes when big organizations have kind of made that argument of just telling people what they think they're gonna do, instead of just laying it out there and saying, this is the safest approach. Anything less involves risk. How much risk can you tolerate? Simple as that. And I think that is what I want my message to be, you know, here. This is where we are. These are the things that have worked for us thus far. And these are the things that give you the best protection that you can get.
I don't want to ruin that because that was really well said. Thank you for showing the personal side that you are human. Thank you for sharing it with us. We know that you are you're professional, but we know that you are your family man. We know that you are God fearing, and we know that God has prepared you for this, and He's going to prepare you to help lead us through these things. So thank you. In closing, Robert Hall, Project Elect, enthusiastic leaders engaging in changing times. We thank for the partnership, Mr. Wheeler, our project chair-elect, for letting us have this moment. Thank you for your service. We thank all the healthcare professionals on the front line, just like you. Maurice Schumpert, our man behind the camera, secretary for Project Elect, we thank you as well. And until next time, we ask you to share this. Also, check our YouTube channel. Check out Project Elect, not only Facebook, but we also have a website. So until next time, God bless.